Alcoholism. 8 to 14% of people in the US will develop alcohol dependence in their lifetime. Alcohol is responsible for approximately 100,000 deaths annually. Alcoholism is more common in men at about a 2-to-1 ratio, however, the rates are recently increasing in females. Most will start exhibiting alcoholic tendencies during their adolescent years. The US government considers safe drinking levels to be 2 drinks per day for a man and 1 drink per day for a woman. Heavy alcohol consumption isn't always easy to detect, so often practitioners will use this simple CAGE questionnaire. It is made up of 4 simple questions, and all it takes is 2 positive answers to these questions to consider alcoholism to be a problem in that patient. For alcoholics, alcohol makes up approximately 50% of their daily energy intakes, leading to many nutritional deficiencies, especially because they tend to have poor dietary habits as well. It leads to many vitamin deficiencies such as vitamin A, B1, B2, B6, and folic acid, as well as some minerals such as magnesium. Now let's turn to our experts to see what they think we can do to help.
Hi, I'm intern Alicia Dodge, and I have found that excessive alcohol intake depletes the body's stores of niacin. Alcohol can induce a niacin deficiency through multiple mechanisms, including decreasing nutrient intake, impairing absorption of nutrients, and reducing liver function. A deficiency in niacin presents with fatigue, a red and swollen tongue, indigestion, depression, as well as dermatitis, diarrhea, and delirium. Niacin is the precursor vitamin for the formation of alcohol dehydrogenase. Increasing niacin can help the liver to metabolize as well as eliminate alcohol from the body. Niacin can be obtained from the diet with foods like meats, eggs, fish, and fortified grains. It's encouraged to consume at least 100 grams of protein every day. A niacin supplement may also be an option. To treat or prevent a niacin deficiency, the recommended dose for adults is 300 to 500 milligrams a day. There are some things to note before deciding if a niacin supplement is right for you. Niacin can cause facial flushing, itching, and tingling. As well, doses above 3 grams are linked to liver damage. There is also the added concern that consuming alcohol with niacin increases the risk of liver damage, so niacin should only be taken away from alcoholic beverages.
Hello everyone, Dr. America Lead reporting from home with some information for you about thiamine deficiency and alcoholism. Now to discuss thiamine, it's a key nutrient in biochemical and physiological processes, and it's therefore essential to normal growth and development. The body does not make it itself, which is why we have to get it from our diet. Now in alcoholism, there is not an adequate intake of calories and nutrients, which is where the thiamine deficiency occurs. A thiamine deficiency can affect various organs of our body, but the most detrimental effects are seen in the nervous system. Neuroinflammation and neurodegeneration are commonly seen and can lead to neurodegenerative diseases. Now, in general, when you see a cognitive impairment in alcoholic patients, this is an early sign of a thiamine deficiency. The connection between the cellular mechanisms surrounding thiamine deficiency neurodegeneration is not clear. However, recent research shows that thiamine deficiency can cause oxidative stress, endoplasmic reticulum stress, and autophagy within the brain. Other studies also show that thiamine deficiency causes enlargement of the lateral ventricles of the brain. Chronic alcoholism and severe thiamine deficiency can lead to an acute pathology called Wernicke's encephalopathy, which can progress to Wernicke's-Korsakoff syndrome. Now, in Wernicke's encephalopathy, there's a classic triad of symptoms, which are ocular findings, cerebellar dysfunction, and confusion. Basically, what happens is thiamine is essential for the metabolism of glucose, and without thiamine, the glucose must be metabolized anaerobically, producing lactic acid. And in acidosis, it affects the periventricle structures, causing all these symptoms.
I definitely agree that a B complex is a great supplement for alcoholics to consume to address those nutritional deficiencies that may be present. And it has all those additional benefits. However, it may need to be an increased dose for certain vitamins, such as thiamine, which may need to be up to 100 to 250 milligrams a day. And thiamine actually works optimally if magnesium is also consumed at approximately 50 millimoles per day. Magnesium also has the benefit of improving liver cell function, electrolyte status, and muscle strength. Thanks to our experts today, and always remember to drink responsibly.